Hello, everybody. Hi, I'm seeing the screen fill up with faces. Some familiar faces. Wonderful. Some folks I'm seeing for the first time. So welcome, everybody. This is really wonderful. Welcome to this special session, uh, this special time together to talk about chaplaincy, Buddhist chaplaincy, and then a little bit about what we do and offer here at the Sati Center. So, in total, we're due to run for 3 hours. It's quite a long session because we've got a lot that we'd like to talk about, and we'd also like to make some space for questions, any questions that you might have. So, we'll take a little break in the middle. So, we'll sort of have two sessions this morning with about a 15-minute break in the middle. So I hope that's enough time for you to do what you might need to do. Before the break, for the first half this morning, Jennifer and I are going to be talking about sort of chaplaincy in general. You know, what is chaplaincy? What's it all about? How does it look? What does a chaplain actually do? You know, what does this work look like? You know, what shapes and sizes does it come in? Okay, and then after the break, we're going to focus more specifically in on Buddhist chaplaincy. We're going to have a couple of folks join us who are graduates of the Sati Center's Buddhist chaplaincy program, both of whom work in different areas of chaplaincy now. So they're both going to come and talk a little bit about what they do. And then we'll talk a bit about the program, the Buddhist chaplaincy training program offered at the Sati Center. Okay. And then after all of that, there'll be more time for questions. So that's a very sort of rough sketch of the day. So just before we start, there's a couple of things that first I would just like to invite us all as we're all kind of dropping in to this space from different places, different time zones. For some of us, it might be very early morning. For some of us, it's much later in the day, coming in on the evening. That's me. I'm over in France right now. So as we all just come in, I'm going to invite about a minute or two of silence and settling, just to allow ourselves a little breathing time and to let our bodies know that we've come into this space together and that we're ready to start. So I'm going to ring a bell once to start this little period of silence, then I'll ring it again when we're done. It's me. So I'll pass on to Jennifer now. And Jennifer, hello, good morning.
So welcome everybody, near and far. Once upon a time, people attended the Buddhist chaplaincy training from different parts of the United States, and it's delightful to have people from all over the world, since you can participate online, or in person. And we have had people come in person from various places. There actually was somebody once who came from France, and then she decided it was too much travel. So my teaching style is to talk some and then to recollect my thoughts and listen for how what I'm teaching is landing, and also to listen inside about my original plan and to stick to the plan or adapt the plan based on what I discover along the way. And I'm looking for the link from Vanessa. So today, this morning, in the first half of the morning, first half of the session, I'm going to talk about what chaplains do, whether they're Buddhist or Methodist or Anglican or Jewish. There's a set of skills that chaplains cultivate and use. And so, and they're not, in my experience, completely digestible until you take the training. So, for example, um, providing spiritual care to people experiencing grief and loss. So there's a understanding that chaplains have about grief and loss and bereavement. And I have found as a healthcare chaplain that the newer somebody is to the profession, the less they know or understand about grief. And the more in healthcare, people get very task focused, And so there's been a few times when I've talked to somebody and said, I think their grief is really acute right now. On a scale of 1 to 10, it's an 11, So I don't know that what we're telling them is really entering their understanding or not. They may need some time to metabolize their experience to the point where they can engage with us in a manner that we're used to. Okay, there's my example. Back to where we are. Can I get a show of hands of people who have done some training in caring for others, one form or another, medicine, therapy? Great. Okay. Great. Super. Thank you. Yeah. This gives me an idea of the crowd. Yeah. And in the chat, I'm going to click on Vanessa's new message. Oh, sorry. You're probably still working on it, Vanessa.
No, I sent it to you as a direct message on the chat.
Thank you. Okay. On the chat. I'm on the chat. Okay. I clicked Vanessa Abel direct message, but I don't see anything, my friend.
How about I send it to you on, do you want on a different, how about by email or something, Jeff? Would that be better?
Slack.
Okay.
Thank you. So chaplains, regardless of identification with a faith tradition, the skills they share fall into a few different buckets, if you will, and I'll just describe those buckets briefly. One is a big bucket, which is called self-understanding or self-awareness. Who am I in relation to others? How do others people perceive me? What's my understanding of my upbringing and how that gets expressed in my actions as an adult, even though it's been a while since I was raised in my family. These things carry on. Also, what are my strengths and gifts? I see the screen now, Vanessa. Thank you. And what are my liabilities? Like what's my Achilles heel? What triggers me? So for example, do I habitually try to have people in a group understand that I'm the smartest one amongst them? Yeah. or do I understand that the way I speak and come across seems either confident or arrogant, depending on some of your worldviews about women's roles in society. Yeah. I actually think they're both sides of a coin. Yeah. The second bucket is understanding of religious traditions and spiritual paths. So that when somebody says, and I introduce myself and they say, I am a Mormon and I have people coming to visit me, so I don't need a chaplain from the hospital to engage with me, you know. And my understanding of the Mormons is that they like to be cared by other Mormons. It's very important in terms of their uh, tradition, values, and norms. Yeah. Now, if somebody said, I met them and they said, I am uh, an Orthodox Russian Catholic, that would be a little trickier because the Russian on top of the uh, Orthodox um, on top of Catholic is a very unique combination and very prevalent in places like Venezuela, you know. So I know a little bit about it from working with somebody once upon a time. And by learning other religious traditions, I have more tools in my pocket, if you will. Yeah. Other interpersonal skills in the second bucket are how to begin and initiate a spiritual care conversation and how to end, how to say goodbye, how to know when it's time to leave the room. Yeah. Those are skills which require a good deal of situational awareness. Like, what's the situation that I'm in? What is unfolding? And what do I think is an ideal path forward? Yeah. And if anybody has a specific question, or if I'm being too brief in my explanations, please let me know. The third bucket is uh, understanding of uh, human nature. And there are definitely different windows in which one can peek into the nature of humanity. So, for example, group dynamics, like what happens when a bunch of people are together? You know, what can be expected? You know, because there are observable patterns in groups as they relate to each other and the context that they find themselves in. So, and related to this is family dynamics. So, probably everybody on the screen now and a few extra uh, can articulate how the dynamics were in their family. So, for example, it's helpful for me when I enter a family meeting where there's probably uh, the spouse of a patient and the brother of the patient and the patient and husbands or wives offspring, And so I might ask, how many children do you have? And then ask who the children are. And then I might say, and who's the oldest? And in some cultures, it's important to know who the oldest is, because the oldest child is often a prime decision maker. And it's part of their role in the family is that they have a leadership amongst their siblings, for example. And then the last bucket is the how to function as a chaplain. So how to communicate about spiritual care to people that aren't familiar with it. How to say goodbye at the right time. How to communicate with other disciplines, doctors, nurses, respiratory therapists, physical therapists. What do they need to know that I think is important, such as I might put in a health record that that I discovered that the wife and wife are have different opinions about the current health condition of one of them. So, for example, when people come to the hospital, it's kind of shocking. Nobody plans a hospital stay like you plan a vacation. People wake up and then find themselves in the emergency room by the end of the day, unexpected. And so they're trying to digest, metabolize what's happened to them. And that may mean that they don't understand something the first time they're told. So I might inquire to somebody who I'm meeting for the first time, what is your understanding of what's happened here for you today? And that what might happen tomorrow. Yeah. And then if they don't really understand what got them here, but I see in the medical record that they had trouble breathing, and that they're doing a workup of the person's heart and lungs, I would listen for uh, whether they're talking about their heart and or their lungs. Yeah. And then I might communicate my impression that they have absorbed about half of the information that is available to them, and that we may need to re-educate and inform the patient and the family accordingly. Uh, yeah. I'm going to pause and take a sip of liquid. Excuse me. Okay, great. And then lastly, I'll mention chaplains also each have their own what's called a faith identity or affiliation. So Roman Catholic, Methodist, Renewal, Judaism, the Swedenborg tradition, um, what's the word I'm looking for? The liberation theology that they identify with the most strongly, that people have the potential for transformation. Yeah. Or as a Buddhist, that we are all in the process of awakening. And as practitioners, we share some common understandings. Yeah. I'm going to just check the chat, see if there's anything there. Using the pause that Vanessa introduced us to. If you want to put something in the chat, that's fine. If not, that's fine too. And in healthcare chaplaincy, so a little context, once upon a time, traditionally in the United States, people followed a particular path towards becoming a chaplain. And it typically involved being a regular church member and having kind of, as they say, grown up in the church. And then they're so passionate about the tradition and their own spiritual path within it that they have a sense of calling, you know, or being drawn to ministry of some sort. And then after high school, people go to college, and then after college, they typically enter a seminary for training in the tradition of their upbringing. And then after seminary, in most faith traditions, people are ordained um, and to minister to a congregation. And after that, in this country in particular, what happened was that some people didn't really fit well in the church. And so people started developing what's called specialized ministries. So I specialize in health ministries. I specialize in the environment and caring for the earth. I specialize in uh, prison or jail ministry. So people had quite a bit of training or exposure, if you will, to their uh, what's called the faith tradition or their original faith experience. Yeah. But there's many more steps. And so one of the things that happens in the Buddhist chaplaincy training that we run at the Sati Center is people over time realize that they're more Theravadan monastic practitioners, and that caring for others is not quite on their radar yet. And the Anakampa program that the Sati Center offers cultivates people's sense of caring. And so I read in one of the chats that somebody's in that training right now. And so that's pretty great. And for people who are beginning to learn about chaplaincy, this can sound pretty daunting. Like, wait a minute, I gotta go to college? I gotta go to rabbinical school or a seminary, I gotta spend 3 months at a Zen monastery, like to get my training, yeah. So, yeah. How am I doing on time, Vanessa?
I think you could have another few minutes until the next section that we planned. So it's up to you, Jennifer. If you feel I can jump in at any time.
Okay. No, I get to talking and then I lose track. So how about if I pause and people take a moment to write down what's happening for them in this current moment, such as I'm overwhelmed, or the questions I came with are not being addressed, or just to keep to yourself. Yeah, just to keep to yourself. I started chaplaincy training before I even knew what a chaplain was. I was interested. I just liked the idea, which I don't know where it came from, except for maybe there was a television show in the United States called MASH, and one of the main characters was a chaplain. Yeah. And nobody really understood what he did, quote unquote, but they were very happy to have him around. Yeah. Yeah, I'll continue for another moment or two. Buddhist chaplaincy uh, is relatively new in our modern day world as a particular flavor, if you will, of ministry or service, spiritual care service. And so people are not clear on what a chaplain does in many settings. And so part of the readiness for chaplaincy and the skill is to be ready to explain oneself and the work of chaplains repeatedly. Yeah. So the good news is uh, there are now probably 400 people that have taken the Buddhist chaplaincy training at the Sati Center. There are probably 100 people who've gotten a master's degree in Buddhism in the local area. And there are more Buddhist chaplaincy education forums to be found in the world, as well as the one that you're joining us today with the Sati Center. Yeah. Okay. And in the Buddhist chaplaincy training that we offer, people discover, uh, I'd say, what it's like to be a chaplain, and they discover if they're suited to it or not. Some people, it doesn't mesh well with their values, their life experiences, their intentions. And so it's just not a good match, kind of like, yeah. So, what it's like to be a chaplain, am I suited to it? And then the last question is, do I want to do more of it beyond this year of training? And what do I want to do? So, in the current group that I am a part of the faculty, we have 3 more sessions. And at the last session, a few weeks ago, we asked people to start thinking about what they want to do after the training ends. And often people say, wait, the training is ending? Like it doesn't, they haven't kind of forgotten that we go for 11 months of the year. Yeah. 4 new messages. Thank you, my friends. One question is, does this program prepare students for chaplaincy outside of healthcare? Yes. Uh, as I mentioned earlier, there are skills that are transferable to different settings. chaplains particularly serve in contexts of crisis. So the origins of chaplaincy go back to, and the word chaplain relates to the word chapel. And so when a monarch had large territory that they could not oversee, um, they would send clergy out to live in different places. And so chaplains are mobile, and some people, start in healthcare and then move over to incarceration or um, young people or the environment. Yeah. And chaplaincy also has its roots in caring for people in crisis, a health crisis, the crisis of incarceration, the crisis of being dislocated and far from one's original roots. So, like Father Mulcahy on this television show, MASH, his job was to help people maintain their own religious and spiritual practice while they were overseas fighting a war. In terms, there's another question here about the schedule. Uh, so we have an application, and then we have application season or admissions. And then the course starts in September of every year and meets 8 hours a day, 8 hours or a day once a month. And in between, people read and they write and they do service work. And I'm going to get to a visual here and then go back to share screen. So this is from the sati.org website under the section called curriculum. So what's in orange is what you do on your own. You read, you write, and then you do service work. And then with others, you come to class and do field trips and attend a speaker series, have mentor interviews. So the Friday workshop there on the visual, those dates are set in stone for the most part. So we already have them on the website for each training, the in-person and the online. And only once during the pandemic did I see a date change. So we don't typically change those dates. And so you will not be scrambling to fit something in 3 weeks from now that you didn't know right now or at some point. Yeah. I'm going to stop sharing that.
Hey, Jennifer, can I jump in?
Sure. Go, girl.
I was going to say, and we'll give a lot more detail about this in the second session as well. We're kind of just touching on this now, but in the second session, we'll go a lot more into kind of, days of the week, like really what to expect in terms of how many hours or how much time you need to put in to the program. I was thinking, Jennifer, it's a good time maybe to give more of an overview of the kind of the larger chaplaincy process and the path to chaplaincy,
I
right?
can do that. And then I'll do that briefly, and then you can move on to
Oh, yeah. Or I have the slideshow for that.
A slideshow.
Yes.
Oh, well, uh, I'm I'm intrigued. So if you have a slideshow, why don't we just move on to that?
Okay. Was there anything else? Did I get you in the middle of something? Is there something you wanted to finish with?
Uh, thank you for your attention. We have a few documents uh, on the website, or if I'm mistaken, the website soon that explain some of this more, the steps in the process. Yeah. So I'm giving you the very broad introduction. Yeah. So I'll pass the ball over to Vanessa now.
Thank you. Yeah, like I said, we have a lot more information that we'll give you like later on in the second session, and also send to you as a follow-up email after this session with kind of details about the program and admissions and stuff like that. But just to follow on from what Jennifer was talking about now, or presenting about, chaplaincy in general. What is chaplaincy in general? What do chaplains do? And what I'd like to do now for the next few minutes is kind of just take you through a sort of a timeline, or sort of a progression of, if you're somebody who's just thinking about, perhaps this is something that's interesting for me, this could be a direction for me. Where do I go now? What do I do? I know that for myself, I'll tell you that, 7 years ago, I was at my practice center, my meditation practice center, and I was just walking past the notice board, and this notice caught my eye, and it was a little flyer for exactly this event. Pre-pandemic, I think this used to actually happen in person, when the training was only in person as well. Now we have the training in person and online. And I saw the little flyer, and the flyer said, Introduction to Buddhist Chaplaincy. And I'd never seen those two words next to each other. And I was absolutely, something just in that moment when I perceived that, something opened for me, something clicked for me. And I had a very different line of work prior to starting chaplaincy training and then coming into chaplaincy. And really, a lot changed in my own life. And I'm very enthusiastic, about this work, about this training, about kind of many aspects of this field. And I think one of the things that's so encouraging is that there are so many points of entry. There are so many points of entry. So, there's starting with volunteer work. And I see already in the chat that there are a lot of people doing different kinds of volunteer work. And as broad as the volunteering options are really as broad as I think what eventually, if it's something that you are thinking of going into professionally, I think that field is also very, very broad. So I've got a few slides as promised, to show you, just to give you some kind of brief idea about what I'm talking about. So can everybody see this slide in front of me? And this sort of weird apparition of me in the corner, which I've never done before, but it seems to be working. Okay. So how you become a chaplain, what is this journey? What are the stages? So first steps, volunteer work, for example. So this is often, a first step that people who are exploring the idea, exploring the field, depending on where you live, options for different kinds of volunteering are different. Perhaps somebody might have the opportunity to go into a hospital once a week for a couple of hours and be a volunteer there. And maybe that kind of volunteering includes just bringing orange juice to patients, or just chatting with people who are feeling lonely, don't have friends and family around, or going for a walk with somebody. Likewise in hospice. Early on, several years ago, I did some volunteering through San Francisco Zen Center at the jail in San Francisco, where we were part of mindfulness for stress relief sort of group that would go into the jail, the women's jail in some, and do like a 1 hour, offer a 1 hour session of meditation and talking, which wasn't, sort of direct volunteering in the chaplaincy sense, but it was, still offering spiritual care to people. I know that some people volunteer at refuges, for example. Some people have come into our program and they've already been volunteering for the Red Cross. We had a student from Maui who had been volunteering with the Red Cross following the fires there. So sort of crisis, volunteering in crisis, showing up. So there's all sorts of ways. Also perhaps grief groups, grief circles, something like this. There's all sorts of organizations that take volunteers and train volunteers to do this kind of work. And these are, even though they might not necessarily have like the label chaplain on them as volunteering positions, I sort of think of them as, adjacent activities. They use so many of the skills and so much of the kind of discussion and learning and connection around chaplaincy that we talk about is an opportunity in this kind of volunteering work to explore that. Then I think another element is foundational training. So the kinds of courses that are offered, like for example, that we offer at the Sati Center, which is it's not a professional training, and I'll say more about that later, but it's a foundational training. It's a way of kind of taking a tour of what are the various aspects of chaplaincy, what are the kind of basic skills, and also, how does this relate to me? How does this relate to my spiritual practice? How can I really bring what is deeply authentic to me and deeply important to me and real and alive in my practice into this work? So having an established spiritual practice is a very useful thing. It's a very useful thing. As a chaplain, it's probably unusual for somebody who doesn't have an established spiritual practice to want to go into chaplaincy. There are humanist chaplains, there are atheist chaplains working in the world. But that's not to say that, necessarily one wouldn't say that that person doesn't have, their spiritual practice just might look very different. Their spiritual practice might be going for a walk in the forest, writing poetry, engaging in silence in a different way. So there's all sorts of ways that, establishing a spiritual practice can look like. And then another thing that can be very useful and nourishing is community memberships, and that's kind of that can be an extension to the spiritual practice. So if you do, perhaps practice with a group, practice with a sangha, a community, what does that look like? How does that support you? And how does the work that you're doing with chaplaincy then feed back into that community as well? Okay, so that's just some considerations for kind of starting to think about chaplaincy. Then if if somebody has kind of done all of that or is thinking like, yes, this is really a direction that I'd like to move in a more serious way, then there are options for further education. And the standard for chaplaincy education in the United States and increasingly in some other countries, there's now this thing called CPE, which is Clinical Pastoral Education. Which is an education that can be taken full-time, part-time, kind of in unit bites, usually in a healthcare setting, but increasingly this education and training is being offered in other contexts as well. And this, like I said, is the standard, especially, and I'm mostly talking about the United States now, for professional chaplaincy in the US. Okay, so that would be sort of the next step towards professional chaplaincy. And then on the side of one's spiritual practice, ordination is something that starts to be a question. And there's a lot of folks who practice in communities that don't perhaps have like a sort of formal ordination process, and that's okay, not to worry. There are ways in which a sort of an equivalency can be demonstrated. Okay, so that's something a little further down the line, but also something to bear in mind. And then the sort of the final steps, the sort of like crowning, the polish on a professional chaplain's career would be a sort of a certification process. And this comes after one has finished one's formal training. There's kind of an expectation that you would work for another like 2 or 3 years to amass about 2,000 hours of work experience in some way or another. And usually that's, paid work experience, be it in a hospital, hospice, or, it could be volunteering like in a prison or something. And then there's a process of writing a lot of papers to demonstrate professional competence. Endorsement from one's spiritual community is also very important, and a Masters of Divinity. But this is something that's much, much further down the line. So if any of you are sort of thinking, oh, I would really, this is something that I'd really like to follow, but my gosh, an MDiv really does feel like quite a large mountain to climb. There are, I'll just say this very briefly, and there's ways that you can investigate this further. But there are even some institutions now in the States that will take a lot of the spiritual training that you may have done over the years and work that into an equivalency of a Masters of Divinity. Like there's lots of options for that too. So, or you may just choose to go to college and study for an MDiv, which is a wonderful thing to do if that's an option for you and you're able to. Okay. So let me stop sharing there. Where are we here? Lovely. So I'm just looking at Kristen's question about starting this path later in life. I can talk to this because on our program here at the Sati Center, we've had folks enroll who are in their 9th decade of life, in their 80s, and working, volunteering actively as well in conjunction with doing the program. So I've been hugely inspired to see people like many years beyond retirement and, really kind of coming into this with a full heart and lots of energy. And I want to say that, even, and then perhaps sometimes the physical energy might not be there, and I still think it's possible. I still think it's possible to engage in chaplaincy and a lot of the learning and training around it. And, a chaplaincy meeting, a conversation can happen like this. It's a connection between two people, and that can happen in any number of situations and environments. So I wonder if, are there any other questions for now about what I just presented, or perhaps, chaplaincy in general, or what, some of the things that Jennifer mentioned before. And then, like I said, maybe perhaps we'll have more questions on the Sati program after the break, because I'll talk more about that then. But anything just maybe about the sort of general trajectory, or if any of you would like to share kind of where you're at and, what you're thinking about in terms of where you might like to take this for yourselves.
Hey, Vanessa, there's a question in the chat from Dana. I don't know if you saw that one.
Oh, yeah, I'm just looking now. Thank you, Jim. This is Jim, who we'll be meeting later as well. Should chaplains in training be involved in significant experience with their own family members, illness or dying, or is it preferred that their training be focused on non-family members? Dana, this is such a good question. I found, I can speak from personal experience, and for a lot of the people that I meet who come into this training, that very often it is experience with the illness or the caretaking of somebody close to us that could bring us into this orientation in the first place. I can speak to, in my 20s, I was very close to my grandmother, who was diagnosed eventually with lung cancer. And I had the privilege of being able to move in with her and care for her for the last 6 months of her life. And that experience, which I was lucky enough to be able to participate in fully and wholeheartedly and put the rest of my life on hold for 6 months, opened me up to a relationship with life and death and dying that I hadn't anticipated to be possible up until that point. You know, this kind of the intimacy with what was supposed to be a difficulty, you know, which was what was supposed to be the absolute worst case scenario, that actually revealed itself to be a most wonderful opportunity for growth, for contact, for really feeling the power and the energy and the possibility of spiritual practice, of healing, and of, you know, facing something that might be a very deep fear, and, you know, what that brought. I found it an extremely energizing and life-affirming experience, and that point of reference opened up a whole new possibility for me. And so I think that those of us who have that experience with loved ones who have been sick, and perhaps sometimes that experience is not in the least bit pleasant, you know, perhaps it's been very unpleasant and very traumatic, and perhaps we have a lot of pain and grief that resonates still around that. But even that is something that we hold and we carry, and that we can work from as chaplains. You know, this is something that really that can be a great generator of empathy and compassion for others, you know, when we've experienced this in our lives. For the actual chaplaincy training, you know, I've seen a lot of people go through the training, and the volunteer work that they've done has been, they are a primary caregiver to somebody, whether it's somebody in their family or somebody very close to them. And having that experience while doing the program has been valuable, to say the least, to them. So yes, so that's the long answer, Dana, to your question, which is, you know, absolutely, at least as far as our training is concerned, caregiving with family members can be a very, very rich source of practice. Yeah. Perhaps if you did put a question in the, here's another. Oh, there's lots in the chat now. Relationship or interface between working as a professional, earning a living, and volunteering. Yeah. Jet, if you wrote that question, would you like to just say a little bit more about that, like what you're thinking in terms of that?
People were all in different stages. I'm a 76-year-old person, and done a lot of work in my life, and looking forward to continue that. But there's no need for this one at this point, for this to have any job aspect to it, any professional aspect to it. So just wondering, in the moving forward with this, you know, there's a lot of different needs in all these faces that we see, and just wondering what would be worth sort of being aware of in that process, in that relationship. Maybe there's nothing, I don't know. I hope that brought a little more clarity than my
sure.
chat.
Absolutely. I also just love to hear from you. Thank you. I really love to hear people's voices. I'm sort of straining to read the chat, but it's wonderful if you come forward with your questions too. This is great. And we get to meet you a little bit too. So like there's all sorts of sort of levels. I wonder if this answers your question. There's all sorts of levels, like I said, that you can enter into chaplaincy work. You know, there's you can volunteer, you can train professionally, you can, you know, go on to do professional work. It's paid, it's unpaid. You know, some people do like a few hours a week volunteering and then support that with another job that they do. Some training is paid. You know, full-time CPE residency, actually residents receive a stipend in a hospital. So there's, you know, there's ways in which it can be balanced. You know, it can be balanced because I think that there's a lot of scope for flexibility in it. So I you know, I think that there's, you know, there's all sorts of ways to make it work.
Thank you. That was helpful.
Yeah, thank you. And I'm just seeing that Jim's comment there, where he says that most of the students of his last cohort of CPE were in their 70s, retirees, and did CPE for the love of learning and becoming better volunteers. It's wonderful. Yeah. And Dave from France is asking, is CPE a thing in France? Dave, if it was, if it was, the world would be a different place. There is some chaplain, because I myself I'm in France too, so I'm beginning to understand a little bit more about what's available in France and other countries outside of the US. I can tell you that CPE is beginning to be available in Ireland and the UK. There's no such course in France right now, but there are some other chaplaincy training options at universities and places of further education. So, and yes, and I'm very happy to connect with you directly. You know, if you'd like, we can share some more details about that.
Vanessa, this might be a time to introduce the word discernment into our offering here. And so with Jet's question and a couple of them, I think there's a process of development. And part of the development is to consider, you kind of feel like maybe you've come to a crossroads in your life and you're like, am I going to turn left? Am I going to turn right? Am I going to go straight ahead? You know, well, to the left looks sunny, to the right looks rainy, and to the north looks like there's a truck stop that probably has really good greasy food. So these things inform my decision. So this presentation may or may not start you off on a process of realizing that you're at a crossroads and you're considering the left, the right, the straight ahead. Yeah. So it's called being in discernment. Yeah. And it's part of something called spiritual formation. I'll leave it at that. Thanks.
Lovely, thank you. Yes, thank you for evoking that. Discernment is it's a word that if you come into the world of chaplaincy, you hear a lot. I am looking at Jessica's question about the day-to-day work of chaplains, and actually I have another little visual I can share about that. So I'm going to go ahead and just put the slides back up. So this just goes a little bit more into like, what do chaplains actually do in the day-to-day? Thank you for the prompt, Jessica. So again, thinking about the different levels of chaplaincy work through volunteer work, and these are kind of quite sort of, you know, foundational chaplaincy skills and chaplaincy activities. Chaplains provide company, accompaniment, and ministry of presence, something we call the ministry of presence, which is the way in which we work with our presence through our spiritual practice, providing spiritual and emotional support to people, supporting difficult conversations, you know, things that might be hard to talk about in a time of crisis, in a time where there's very strong emotions, panic, fear. What does that look like? Facilitating prayer, facilitating meditation, perhaps being able to set up a little ritual even, to support somebody in the moment according to what they might need. Connecting people with other spiritual resources. Maybe as a volunteer, you might meet somebody from another religion, perhaps a Muslim who would just really like to be connected with an imam from a local community, but they're unable to at that moment because, the circumstances that they're in, so how can you as a chaplain connect them with what they need? You might not have that resource yourself, but you can be a bridge to what somebody might need. And then some people through their volunteer work might facilitate groups like circles. I mentioned the volunteering work at a jail where, these would be kind of group sessions of meditation and talking. So that this kind of work. And then what chaplains don't do, whether they're volunteering or professionally, this is just sort of one kind of big point, is you don't proselytize. We don't push our own opinions or push our own spiritual traditions onto anybody. Okay, that's always a big worry of people sometimes when they meet chaplains for the first time. They feel like, oh no, no, I'm okay, thanks. They think that they might be about to be sold something, and this is especially scary, for people who are in a vulnerable situation, like in hospital, if they're very sick, if they're in prison. So this is a very good point to bear in mind. And then on a professional level, what does a professional chaplain do in the day-to-day? And I'm going to talk, most of my chaplaincy experience is in healthcare, but I think a lot of these, a lot of the kind of code switch can happen here, where you could imagine a chaplain like in another environment, perhaps doing similar kind of work. A professional chaplain can be employed full-time at a place. They can be employed part-time or on a kind of day-to-day per diem basis. And examples of the kinds of activities and responsibilities of chaplains, for example, in a healthcare situation, responding to referrals. Somebody in the hospital wants to see a chaplain. That's a very, very basic kind of call and response. I'd like to see a chaplain for whatever reason. Making rounds, if somebody hasn't asked to see you, you can go and meet people, introduce yourself, let people know what is available to them. Okay, so it's not necessarily sort of jumping on or forcing ourselves onto somebody, but just, here's what's available to you as a patient in this hospital, as a prisoner in this jail, that you actually do have the right to talk to, or you have the opportunity to talk to a chaplain if you'd like to. Caring for the people, checking in for the people, with the people who work at this place. This is a huge part of a chaplain's role, whether it's doctors or nurses, whether it's people working in the prison system, chaplains who work in education, working with the staff in educational institutions, being there for the staff. Often that part can really be overlooked. And a lot of these people are working in very high pressure, very high stress situations. So the presence of a chaplain can really be useful. Working as part of an interdisciplinary team. This is one of the things that I've loved the most about working in a hospital, is that as a member of the spiritual care team, you're in consultation with social workers, psychologists, doctors, nurses, all sorts of people from different disciplines who, absolutely refer to the spiritual caregiver, as somebody who has special skills and a special kind of insight with patients that can be really helpful and make such a difference to outcomes. It's really, there's a lot of research that's been done, a lot of statistics that are out there, you know, that show that people who've had access to spiritual care in a interdisciplinary hospital, for example, situation, you know, really do often have much better outcomes, and the same with inmates in prisons. So this is you know, this is an important point. Chaplains make assessments. Chaplains add to somebody's medical chart. You know, these are all things that chaplains do as part of the care team. They answer distress calls. They might do one-on-one spiritual counseling. They come to people when they're close to death. They are there after somebody dies. Sometimes, you know, even just to deal with help with the practical considerations of what happens after a death. Helping people decide what they want to do around their care. For example, helping people with advanced care directives. This is something that chaplains do in hospitals. Finding prayer materials, facilitating prayer, joining people in prayer, talking with family members who are feeling disgruntled or fearful, or, you know, who have just suffered a terrible loss. Ongoing support for patients in long-term treatment, you know, people who, you know, when there's a kind of a fatigue around, you know, there's a need for sort of resilience, you know, chaplains can really be helpful in these situations. Interfaith ministry, you know, ministering to people from different faiths, you know, meeting people from other walks of life, other cultures. Buddhist specific support, if we do identify as Buddhists and if we have certain skills around Buddhist specific chaplaincy. Sometimes chaplains are just called on to perform a marriage or a baptism. Trent, who's one of my fellow faculty on the online training program, was just telling me the other day that he's the director of the San Francisco night ministry, which is a kind of a street chaplaincy for unhoused people in San Francisco. And he was just saying that recently one of their street chaplains was just called on to perform a marriage ceremony, like at 3 a.m. on the streets of San Francisco. And they did that. So another wonderful skill. So in general, you know, whether it's professional or volunteer, there's this kind of sense that a chaplain's always learning as well, you know, always kind of taking in more about ethical standards, about different perhaps theoretical models of intrapersonal behavior. And another thing that a chaplain does is, well, in a hospital situation, is these things called like on-call shifts. So they might be on call and they might be the only chaplain in the hospital who responds to emergency calls, who goes to the ED or the OR or to the pediatric department, etc. So that's there, and that then leads us on to the next bit. So that's just something else that I wanted to share. And we still have a few more minutes until the break. So I wonder if there's any questions on the back of that.
Namaste, Vanessa. This is Morgane.
Hi, Morgane.
Hi. Are we allowed to ask specific questions? I'm actually very interested about any experience, because you mentioned that chaplains might change things in records or write things down in the records, right? And I was wondering if you had any, that seems daunting to me based on my own medical experience. Not that I would necessarily be going into healthcare, but I know in my area there would be a lot of need for that, and it would be more possible. So I was wondering if you could speak to any times or any dealings with conflict in that. Does it create an incredible amount of stress? Only because I noticed that there's a lot of stress, it seems, within the healthcare realm already. So I was just wondering what insight you might be able to offer when we're considering this.
Thank you for naming that, Morgane, and, you know, from whatever that speaks to in your experience. So a chaplain definitely wouldn't change anything in somebody's medical chart, but in any medical chart where there's a section for any member of the medical team to write notes after a visit, a chaplain would just do the same thing. So a chaplain would, you know, maybe write something like, you know, this is how I found this person today. This is what we talked about. You know, perhaps I have a strong sense that, you know, this person values this thing, you know, values walking in nature, values their connection with their children, just something that might have come up that seems perhaps helpful that other members of the medical team might, learn something from, and
Okay.
perhaps be able to augment their care as a result. So that's the kind of thing I'm talking about. Yeah.
So really thinking of it more as almost a tool that can be used to help to facilitate a better understanding of the situation overall.
That's
So it
right.
can be a benefit as opposed to maybe a conflict.
One would hope.
Okay,
Exactly.
very good. Thank you very much. I appreciate it.
Lovely. Thank you, Morgane. Okay, great. Well, shall we take a break? I think it's time for a cup of tea. We've got about 15 minutes. That's just about enough time to boil a kettle, isn't it? And we'll come back at 35 minutes past the hour. Okay, so I'll see you all back then. Lovely. Have a nice break. Lovely. So welcome back, everybody. This is now the second session of our introduction to Buddhist chaplaincy session this morning. So for this second session, as promised, we're going to focus in a little more on Buddhist chaplaincy and what we're doing as Buddhist chaplains. To start the session off, we're going to hear from Jim first, Jim Lakey, and then from Ram. And Jim and Ram are both former students, participants of the Sati Center Buddhist Chaplaincy Training Program. They've both recently taken the course, I think in the last 3, 4, 5 years, both of you. It's 5 years for Ram, and I think 3 years for you, Jim, was it? And both Jim and Ram continue to work in chaplaincy in quite different ways. So Jim has been completing his CPE, that training that we were mentioning earlier, down in LA, around about where he lives, and Jim is possibly looking at continuing that and working in hospital chaplaincy specifically. Ram is working in prison chaplaincy, and he is also a member of the faculty for the Sati Center's eco chaplaincy program. Okay, so he does those things too. So Jim is going to start us off by talking for about 10 minutes or so. Is that right, Jim? About what is Buddhist chaplaincy to you. That's what we'd really like to hear about from you, Jim. And then after that, from Ram, will tell us a little bit about how the Dharma supports him in his prison work. Okay, so Jim.
Yeah, thank you. So I talk a little bit about my view of what Buddhist chaplaincy is, but also aware there's a question that came in from Amanda and Carla. They kind of wanted to hear more specific examples of the path people take. So I'll share some of my path as well as one version of what that might look like. So in terms of Buddhist chaplaincy, I guess the way I see it is that the Buddhist part that makes a Buddhist is you. It's what you bring. There's not really a thing that's Buddhist chaplaincy that's different to other types of chaplaincy. Say like in a healthcare setting, in California, I think we have 2% of the population are Buddhist. I think around the States is 1%. So you're not encountering a ton of Buddhists necessarily in any given setting. Maybe there's situations where that's more of a thing. But at least for me, I function more as an interfaith chaplain. So the Buddhist part is really what I bring. So my background, I'm a Zen priest, and I spent a long time training. Spent about 6 years in a Zen monastery here in Southern California, and always kind of wanted to figure out how to bring that forward in a meaningful way. And for me, chaplaincy really kind of checked the box. So I think to be a Buddhist chaplain is to kind of figure out how you connect to the Dharma and how you're able to bring that forward and to share it. And I think, I've had this experience of feedback from others, and I've heard other chaplains and educators talk about their experience with Buddhist chaplains as being pretty positive, because a lot of what we're trained in is very relevant to the skills that a chaplain calls on. This kind of inner quiet, maybe a sense of kind of knowing of one's own emotional life, of a kind of sensitivity to self and others, and this ability just to listen very deeply, to be very present to other people and one's own experience. And not everyone has that, It's quite amazing when you go into, if some of you guys go into CPE and you start training alongside people from other religious traditions. For me, I was amazed by this wealth of knowledge and skill that people brought from these different faith traditions. But one thing that a lot of them seem to lack, that I would say the Buddhists really have in spades, is this kind of reflective capacity. And just something that feels a little more grounded, a little more present. I'll often get the feedback for me as a chaplain that I have a very kind of calm presence. And that's not my personality. That's really coming from my Buddhist training. So I think when I show up in the hospital where I work, probably 5% maybe of patients end up knowing that I'm a Buddhist. It doesn't come up. I just wear normal clothes. There's nothing that makes me stand out. I'm a priest, but I don't keep my head shaved anymore or anything like that. So there's no real like physical indicators that I'm a Buddhist. It's only if people will ask me and they're genuinely curious, I'll share. But otherwise, people probably assume I'm a Christian because that's what the majority of chaplains are. And functioning as an interfaith chaplain, it's not necessarily relevant to share that about me unless it becomes relevant. The relationship between chaplain and the person that you're caring for is kind of paramount. And you really have to tailor what parts of yourself you're sharing and making use of to really take care of that relationship. So for some folks, that might be sharing more of your Buddhist practice and being a bit more explicit about that. But a lot of it is really just embodying what you've been training as a Buddhist, this maybe deep sense of care, of connection, of compassion, of wisdom, and really finding ways to kind of bring that forward and share it. So, awareness is a big thing, and we maybe sometimes take it somewhat for granted in Buddhist circles because we're so steeped in it. But that's the thing that I think we have that really allows us to serve well and serve others well as a chaplain, whether it's awareness of other and this ability to have kind of accurate empathy, where you're really able to listen to what someone's saying and kind of maybe intuit some of the deeper meanings and clearly reflect back and summarize what you're hearing so someone just feels heard. That can be such a powerful gift. And over time we can learn to have this kind of empathic ability, which is more about the accuracy than kind of a vicarious form of empathy where you're taking on other people's emotions. And maybe that's something, again, as Buddhists, that we've kind of trained to be with our emotions in a more spacious and caring way, that we don't have to hold on to the experience of others, but we can really be present for it. So perhaps it gives us more of a sense of resilience as well. And also I'd say humility, like as Vanessa was saying, it's important that chaplains don't proselytize or try and push their beliefs. And I'd say Buddhists are very well positioned because we're kind of trained not even to hold our beliefs too strongly, right? Like the idea of using the raft to cross to the other shore, then leaving the raft behind, for instance, is kind of built into our sense of what the Dharma is and this idea of not carrying things that we don't need anymore. And certainly not trying to push that onto others, but kind of holding our beliefs lightly. So I think as Buddhists, we're very well positioned to walk into situations with a sense of openness and humility, that not everyone else in other faith traditions necessarily has. So that's kind of my take on what Buddhist chaplaincy is. It's more, there's something about the spirit of chaplaincy and Buddhism that just mesh so well, I think. And whether we're functioning or seen as a Buddhist, that's kind of up to you. I know some chaplains may really make that explicit, and they'll show up and they look very Buddhist, and that's how they function. And that's one way to do it. And the other is more the kind of incognito, using it as appropriate kind of way. But, you know, those deepest parts of yourself that Buddhism is kind of touched into and you've been working with and training and purifying, those are the parts that will really come to life and be of benefit to others as you move forward. So yeah, for me, my path, as I said, I'm a Zen priest, I'm a Zen teacher. So, you know, I really kind of dug deep into that for a big chunk of my life. But I still was kind of left with a sense of something missing, of how to really apply the Dharma in a meaningful way, kind of outside of a Dharmic community, right? It's one thing to show up say, in a Zen monastery or a Vipassana center, but how do you show up in a community and meet people who, you know, have very different beliefs and understandings and have very different life experiences, and really meet them in a meaningful way? So for me, my vows as a priest, chaplaincy is kind of fulfilling them in a way that nothing in the world of Zen felt like it did. So I did the Sati program, and then I signed up straight away for CPE. And I wasn't in a position to do a CPE residency, which is where you do it full time for a year. So that's one option you can do. You do get paid if you get a position as a resident. The other option is you can do CPE in discrete units. Each unit can last either 3 months if it's full time, or it can be extended out to about 6 months if you're doing it part time. Most of my units I've done part time and continue to work at the same time. So that became sustainable for me. I'm self-employed, so I was able to kind of make my schedule work. So it is possible to do CPE training and work at the same time for those who aren't retired. It takes longer, you know, my path through CPEs, I've got 1 more unit to go and I'll be done by the end of the summer. So it's been about 2 years and 3 months. But that is one model of doing that. And you can do CPE online as well now, which adds even more flexibility, and you still have to find the clinical placement locally, but you can do the educational aspects online. And then maybe I'll just say a little bit about the MDiv question too, because if you want to become a board certified chaplain, and you don't have to become board certified, you're employable once you've done 4 units of CPE. But some hospitals and other institutions like you to be board certified. It's a level of professionalism. You get paid more typically if you're board certified. And to do that, you need either a Master's of Divinity or equivalency. And the bodies that award board certification allow for equivalency from traditions like Buddhism that don't have clear paths through seminary, which have academic components. And there's organizations like the Shogaku Institute who help Buddhist practitioners pull together all of their experience to show, it's like, okay, here's the time I spent on retreat, here's the time I spent volunteering, here's the time I've spent learning about other religious traditions. Then you kind of pull together all these components and show that even though you haven't got a Master's of Divinity from an academic institution, you have done equivalent work. And that's a recognized path. So for those that are concerned about hearing like, you know, oh, I've got to go back to school for 2 years or 3 years and get a Master's of Divinity, that's not necessarily the case. There are other ways around that. And that's what I'm personally exploring as well, working with the Shogaku Institute. And Vanessa's part of that as well. So she's a good person to check in with about Shogaku. So that's probably enough for me for now. I hope that answers some of your questions, Amanda and Carla, or at least like one version of what that might look like. And then I'll pass it back to Vanessa. Thank you.
Thank you so much, Jim. And thank you for following up on those pieces about the MDiv too. So yes, I'll share my email at the end of the session. So please feel free to reach out to me with any questions that you might have around any of this after the session. And so Ram, among the many faces, I can't see you. There you are. Okay,
I'm
I can
here.
hear
I'm
you. Your
here.
lovely laugh. There you are. So Ram, I turn it over to you now.
Beautiful, beautiful. Thank you so much, folks. Can you all hear me okay? Yeah.
Yeah.
Beautiful, beautiful. I'm very happy to be here. Sati Center means a lot to me. And, how you see on my left at the back are my two certificates. One is the Buddhist chaplaincy training. Another one is my eco chaplaincy training. And unlike Jim and Vanessa, these are young people. I bloomed very late. I joined the chaplaincy program when I turned 60 in 1920, I mean, 2020. Okay. So I've been in this path for 5 years, and I've been working as a prison chaplain, jail chaplain for 4.5 of those years. And I can honestly tell you, I never expected my retired life to be this awesome, just being in this area. I've been practicing Buddhism for 15 years, but bring that all of Buddhist practice into something meaningful uh, has been nothing short of amazing experience. Uh, this is one area I think craving is allowed, so I crave for more of this area of engagement. So, but just as Vanessa said, I put on different hats. I worked 25 hours as a jail chaplain in Santa Clara County main jail, as well as the Elmwood jail. I'll talk a little bit more about that very briefly. I get into the question. Second is I'm also a Red Cross disaster care spiritual chaplain, which I spend about 5 to 10 hours a week. I started this beginning of the year after the fires in LA, the big ones. I supported about 2.5 dozen people, nearly 30 people there. And then there was this big, what do you call the disaster, tornadoes and flooding and everything in the Midwest, Ohio Valley. And I spent a lot of time. And that allowed me to build into the Red Cross system. Just a few days ago, there's a home that got burned down here in Fremont, California. And one of the sons was living in the 20s, was living with his mother, and he has two other siblings, and the house got burned down and the mother died, and all three siblings have reached out to Red Cross for spiritual care and help. So I already connected with one of them. The other two I'll be connecting this weekend. So the scope of the chaplaincy continues to evolve. The last area is around I started this as a part of the Insight World Aid to bring the caregiving to homeless shelters. So this has been about maybe close to 6 months to a year right now. So we've been offering the chaplaincy service, spiritual service, and guidance, all in the interfaith setting to the homeless shelters. And the reason for me to throw it out there is, except for Red Cross, if you ever want to shadow me, get a feel for what these opportunities look like, I'd be very happy to bring that to you. Okay, I'll drop my email at the end. You want to come and spend 2 hours in the jail with me, or half a day, or a full day with me there, or if you want to join me in the homeless shelter, I'd be very happy to have you join me and get a taste for what a day would look like. Okay, that's the background. And I say that because I want to set the context of how I address this question. The question was, how the Dharma supports me in my prison chaplaincy work? And I've been thinking about this a lot. And essentially, it's not about my knowledge or my hypothesis or even uh, what I think it is. I just want to focus this on purely on my experience in this context, right? And what it really did for me is I've been practicing Buddhism, like I said, since 2010, 2011, about 15 years ago. I've been deep into Vedanta studies for 20 years before that. So I've been on the spiritual path, but pivoted into much more into Buddhism without really leaving behind Vedanta, right? One thing that really caught my attention very earlier on is this refrain in Buddhism, right? A wise person is motivated to benefit oneself, others, and both self and others and the world, right? So that came out almost repetitively in Buddhism. What does benefit oneself mean? Okay, that's really intuitive. What does benefit to others means, and what constitutes benefits? How do I know it's truly beneficial to the others? And what does Dharma teach about understanding of other people's suffering, right? And I think, so I found this particular way is there, what does Dharma say about service, right? That's where I started the introspection from. And then I played around with these words, and English is kind of a peculiar language that way. What if Dharma itself means service? Okay, it's not there is a component of Dharma that calls service. What if Dharma itself is service? And actually, I gave a IMC talk on this topic about 10 days ago. I'll post the link at the end of the talk if you're interested in hearing more deeper my views on that. And what it led me from is Buddhism is really a self-discovery process. I call it, it's not about knowing things, okay, Four Noble Truths, Eightfold Path, Brahma Viharas, dependent origination, you name it, go on and on and on and on. We can read a lot about this. We can listen to Dharma talks day in and day out. There is an audio Dharma with us. We can listen to it practically 24 hours, right? And the question is, how does this Buddhist path allow me to explore my inner conditioned life? So what do I learn about myself? Where does this come from, right? And the whole premise of all of this is, Gil jokes about it in a way, Buddhists are, what's the right? I think he implies something like, all Buddhists do is talk about suffering, right? So it's almost like a MS degree means master of suffering. That's what Buddhism means. We kind of learn about suffering in so many different ways. In a sense, we are a student of suffering. What does it mean to suffer? How do we get rid of suffering? How do we sustain a life without suffering? So on and so forth. And this is where the discipline of cultivating the inward look started for me, right? Gaining wisdom through self-awareness. And the key phrase is gaining wisdom. And the second part is self-awareness, right? Just to spend some few moments just thinking about these two phrases, right? On one side, Buddhism teaches there is no self in a sense, right? But to be aware is an important thing. So you be aware of some entity, and that's called a self. So Dharma teaches basically, right, is that self is a flow of states or a processes or conditions. Okay? If you want to go deep into it, you would say in the 12 links of dependent origination, there is a particular link called becoming, right? If you're familiar with that. And that's really where there's a beautiful book by Thanissaro Bhikkhu. The title of the book is The Paradox of Becoming. I studied this many years ago, and I really use that as some kind of a go-to book often, right? So the question is, when I take up a role, what does that role really mean? How do I bring Dharma into that role? And really, chaplain to me is one such role I take, which encompasses, or at least try to portray myself in a most dharmic way, as taught by Dharma, right? Though the question, this would allow, okay, this is the entity that is going to answer the question of the refrain. A wise person is motivated to benefit oneself and others, and both self and others. So how does this entity or this role called chaplaincy play the role of caring for others? Yeah. In a sense, there are many ways that I portray this. I ask this question many times. In the chaplaincy setting, particularly, it really comes down to the presence I bring in to the situation and to the people. What presence do I bring in? What exactly does that mean? And how am I? Am I coming up with my own conditionality, with my suffering, with my thoughts, with my everything? Or am I able to apply the teachings, be self-aware of everything that is going on me, and yet create the space to position myself to the person, to the situation, and be able to offer service to them, right? So this is, in a way, I call it, the Buddhism teaches us about generosity and be able to bring generosity to the situation. Yeah. Out in the West, particularly, anytime I use the word dana or generosity, the thoughts quickly go to wallet or a checkbook or money as a donation. Okay. But the reality is the implicit value, what we learn is there is so many ways to be generous with time, attention, listening, to empathize, generosity of energy, generosity of knowledge, generosity of caring. And all of these other elements of generosity becomes key to bringing them in front of situations that we can be of value to someone else. So we learn to not only recognize who we are through self-awareness and introspection, but we also create the space and bring this whole generous self of us to the situation that really warrants the attention and care. Okay. So what this leads to is, particularly in a prison setting, I briefly explored chaplaincy in the hospital setting, senior citizen homes, and different setting. There are certain factors that led me into prison. The sad part is, on an average, a person stays in the jail between 2.5 to 3 years. Okay? I've been with some of them for close to 5 years right now. So you have a deeper relationship than a transient relationship of people come and go in the hospital, few weeks, few months at most, possibly some days most often. Here, we are caring for a particular individual for quite some time. So you go through the cycles of a person with anger, anxiety, helplessness, remorse, addiction issues, shame, loss of hope. You really have a full spectrum of emotions that you have a front row seats to. Okay, what this allows, what it really brings out is each one of these opportunities you learn about yourself. What Dharma teaches is to bring the presence and bring the generosity and bring the care in most compassionate way. And that this is the lab. This is the ability for us to bring this collective tools that we've been taught to in a particular caregiving situation. And that is very, very ephemeral, fleeting, fast changing. You see a guy in the morning and then you see the guy next day or next week. He's entirely different. I feel a lot better today. Okay. And there is a gender difference. Caring for men is different than caring for women, and they have different anxiety issues. Many of them have kids outside. They're trying to navigate their life while still incarcerated, and it becomes pretty deep in terms of the cycles of emotional ups and downs the inmates in general go through, and then it gives you an opportunity to be there for them. We are not fixing them. We are not helping them. We are supporting them in a spiritual way. And these people are Christians, Muslims, different sect of Christianity, as in Jehovah's Witness, Catholics, Protestants, you name it. And none of them comes in the way of us bringing our chaplaincy tools and chaplaincy skills to offer a deeper assessment of their situation and really be able to do a very thorough spiritual assessment and analysis and really begin to understand what the suffering is in a way it's relatable to me, and then offer that as a way to counsel them, guide them, and be there with them through the time. So in the other aspect in jail is we don't walk around and say, do you have an issue or do you hate? They have to make a request in the jail. So which means I see the request ahead of time. So I know this person is asking for the help. It gives me some kind of a runway for me to prepare for the person if I know the person already. Yeah. So that kind of helps with orienting myself, bringing my own the past relationship with this guy, what were the past visits is like. And all of this allows me to really go deeper and deeper into not to take this as a check-off item or a to-do list, but really prepare myself in a deeper sense. Am I relaxed? Am I fully present? Am I really be able to offer myself to these people and be able to come and see them? And typical visits go anywhere between 20 minutes to 45 minutes. It's not high. And many of them want you to deal with a prayer. And Buddhism, this is where I feel very fortunate to have the Buddhist approach is we don't have a particular, what do you call, I operate as if Buddhism is not a religion, but it's a way of life that shapes my thinking. It becomes much easier for me to connect with different faiths. Okay? The other area is the notion, as I was going through my own call it the the universe of Buddhist support system. There are sanghas, retreat centers, books to read, websites, Zoom sessions, online forums, podcasts, you name it, right? And all of these are very nourishing, meaningful places to be in. But certainly there are a lot of pluses to all these resources. The question again is, there is an overemphasis of the first line, which is a wise person is motivated to benefit oneself. But the question is, how do we use all of this to benefit others, right? And this is where the teachings of Brahma Viharas come in deep and handy. Okay, this is about cultivating the heart. This is not a cerebral function alone. There is a role for it, but certainly it's much more of a bringing in kindness and compassion to every encounter. And each one of these cases, there is a kindness to self, kindness to others, kindness to oneself and others, compassion towards oneself, compassion towards others, compassion towards oneself and others. Okay? And I see that cultivation as a heart is largely, I credit that to the way the Buddhism unfolded for me. Okay? I was largely a cerebral person. I was literally, I can think my way into anything, or I can solve the problem. I have all those tendencies, which I had to really tone it down. As I found out more and more about myself, I started to become less and less cerebral, or at least brought the cerebral aspect of me out a lot less, and focus more on what does my heart say? How does my heart take the suffering? What does it mean to my own suffering in this regard? And how do I connect these two things and be able to give value to the other one? Who defines the value? Is it me, or is it the person I care for? Right? These are all the ways that questions change from trying to answer it to myself and turn that whole line of questioning off, but come in front of a person who I care and be fully present and figure out, as situation by situation, as it unfolds, what really makes meaning to the person. Okay. So in a nutshell, what I would say is being a chaplain to me from a Buddhist path, particularly, I came up this line. It's a line of service, but the big part of the service is to way to express myself. I feel I have enough in Buddhist teaching and Buddhist practice that I can really bring all of it in a way it can be caring to others. Okay? And what draws me to care is the appreciation of human connection. There is a quality aspect to this. And while we know from our teachings and other things, we are all deeply interconnected in so many ways, but to really bring that connection, let that connection manifest in a way that we truly connect with a person in a homeless shelter, or a person in the jail, or a person sitting on the park bench and saying that is my home. And we really stop judging the people. We really stop evaluating the people. We really turn off the thing. Why is he here? What did he do? What kind of crime did he commit? None of them matters. We just turn all those things off and yet bring our presence to them in a way that's of meaning to them. Okay, that's pretty much what I can, in a summary, what Dharma did to me. I will post the link to the longer 30 to 45 minute talk on this topic. If you want to hear more about it, that's the place to go. Thank you.
Thank you, Ram. Thank you so much. Yes, if you could post that link, that would be really helpful. Thank you. Thank you for sharing all of that, both of you, Jim and Ram. And I think there's a lot in there that maybe, speaks to some of the questions that have come up about, what has the path looked like, for each of you. And I think for every person, it can really be quite different. We have a couple of minutes. I wonder if there's any questions for Jim and Ram. Following on from what they've said, is there anything in particular you'd like to ask them or follow up with? Yes, Eileen.
Good morning, and thank you all for your presentations. And if this question is not appropriate, you can tell me, Jim, but I couldn't help thinking when you were talking, I agree with you, you don't want to push your religion. That's, if you're Buddhist, you don't want to get into that. But I imagine that people in hospitals often have death and life after death on their mind. And so I just wondered, has that come up for you? And how do you deal with that without saying, well, there's your karma and all this kind of stuff, not getting into Buddhist lingo about it. So if you could address that, that would be great.
Yeah, it's an interesting question, Eileen. I mean, for me, I don't really know, so that helps. I don't really have many fixed views about that matter, so I wouldn't know what I'd be pushing on people, apart from my own doubt and uncertainty, right? But I think those things allow me just to be a bit more open and with chaplaincy, you really kind of again coming back to this listening, really listening to where someone's coming from. Are these questions? Are they trying to kind of make sense of it? Is it on a cognitive level? Is it arising out of fear? You know, are they kind of curious? Are they fearful? Are they actually, is that question masking something about concerns about relationships? Maybe they feel like they have done something bad in their life and they're concerned that they won't see their loved ones in the beyond, you know? So it's a case of often kind of unpacking a question like that and really getting to the heart of what the concern is, because it's often not what it appears to be. So as a chaplain, you're kind of just skillfully like listening, reflecting back, and helping people kind of peel back a question like that to see what the pain at the core of that is, and then trying to address it directly. Because getting caught up in like theology or Dharma, it's tempting, but that will just get you in the weeds, and that's not really what the person needs. Does that answer the question?
And we could have time for just one more question. If there's one more question for Jim and Ram.
I have a question.
Yeah, go ahead.
Jim and Ram, you started your journey in this territory a few years back now. What do you wish you had known when you began that you know now? I'll ask Jim to answer that first, and then Ram. And it's just kind of a curiosity I have with people about what unfolds, over time.
Yeah, I see how pertinent that question is. And yeah, I feel like the Sati Center course just laid things out so well for what came after with CPE and volunteering and being in the hospital. I don't think it left me with a sense of things having been missing. I don't know. There's nothing that really jumps out for me with that, Jennifer. So maybe Ram, you have an answer for that.
No, I think what I loved most about the program, why I call it such a pivotal moment in my life is, like I said, I was a very cerebral guy, was expecting way too much structure as against letting things unfold. And that's what was the biggest thing I got out of the Sati Center program. Having said that, towards the end of the program, I want to say maybe May, June months, where we got into interfaith setting, right? There was the biggest aha for me was until that point, I was going through the program, I'm going to be a Buddhist chaplain. All this are going to help me. I had that Buddhist little bit too strongly wired in me. Okay. And I went through the interfaith pattern going in. Then the aha came and said, Buddhist chaplaincy is my inner orientation. And externally, I don't care who I am carrying. Right. So that it would have slightly helped me if I got that fact that most of the people I'm going to be serving are not like me. Right. Practically everyone I'm serving doesn't have my background, my culture, nothing that is relatable to me. That was a big aha for me as I got into the jail work.
Right.
So having that initial orientation, you are a Buddhist chaplain internally. However, you are going to essentially bring yourself to care for people of different faiths, different settings, different conditionality, different upbringing, different everything. That was OJT, on the job training, as I got more and more into the prison chaplaincy, that started to unfold.
Thank you both.
And thank you again from me. And thank you both for joining us today. Okay, so now we're going to segue into talking about the Sati Center's Buddhist chaplaincy training programs, plural. So The original chaplaincy training program that was available at the Sati Center was the Buddhist chaplaincy training that's been running since 2001 and has always been taught by Jennifer Block, who's here with us, and then also Gil Fronsdal and Paul Haller. And then in the last couple of years, we've started an equivalent, the same program, but it's online. So for people who don't live within driving distance of the Bay Area, which is where the in-person program is located at the Insight Meditation Center in Redwood City. So for folks who are not able to commute to that location, there's now an online option. There's an option to take the program online. And I'll just clarify now that they are two different programs. Sometimes people have said, oh, could I, come to the in-person program when I can, but the months that I can't make it, can I do the online? That's not possible. That we are like two separate faculties, two separate cohorts. Okay, so if you start with one, you'll need to continue with that one. So let me put up some slides. Just give me a moment to get it set up. Okay, so can we see that? So I'm going to tell you a little bit about what we study, like what's involved in the formation, and how we study it. So really what it looks like very practically, how many hours of workshop, how many hours of extra assignment time you might need, that can hopefully give you some idea of the kind of commitment that would be necessary time-wise, at least, to do this program. Because I know a lot of people come to us who are obviously, working, some people in full-time jobs, and, they need to know, would I be able to do this? Would I realistically be able to fit this in? So the good thing is it's very flexible. So I think that there is a lot of hope that no matter what you're doing in your life, if you really want to do this, you should in some way be able to accommodate it. So let's start with this. So the way that the course is structured, it kind of exists within these four realms. These are the sort of four main topics within which we teach and sort of transmit the Buddhist chaplaincy training. So there's the area of Buddhist spiritual care skills, so kind of very foundational spiritual care skills, which I'll give you some examples of in a moment. Spiritual formation, which Jennifer touched on earlier when she was talking about, for example, the process of discernment, when we find ourselves at a particular juncture in our lives or a crossroads, how does our own spiritual practice, our own spiritual journey feed into all of this? How does it relate? And then this sort of fourth circle of religion and spirituality in general, having perhaps a wider understanding of the function of religion socially, culturally, our religion, other people's religion. How do they, how do we interact? How do we be curious in a way that, we can learn and understand the way that other religions function and the needs that other people from other religions might have, that we may be able to serve them better. So these are the four kind of broad topics that we work in. So one of the things that we do is basic spiritual caregiving skills, such as, and this is not in any way an exhaustive list. This is just an example of some of the things that we kind of touch on and engage in during the course of the year. So deep listening, reflective listening, active listening. What is that, and what is it to practice that, and what is it to practice it with each other, with others in the service work that we're doing? What is it to offer prayer? have a lot of people, we come to the program, myself included. When I came to the program, I had never prayed with somebody before. So, what is it to do that? How can we do that? What is it to offer ritual, or, perhaps in the context of our own tradition, to offer meditation to somebody in the right moment, in the right context? Working with grief, another chaplaincy skill. Working with bereavement, connecting in some ways to our own experiences of grief and loss, and how can we bring that into being present to others when they're in the midst of grief. And facilitating ritual again, which somehow got repeated on that list. So the context, the framework within which we look at chaplaincy, and we begin to practice this kind of relational Dharma. We do it through the 10 paramis. So there's 11 months of training. And so for 10 of those months, we take one of the paramis as the main theme for the month. And we really sort of deep dive into caregiving through the framework, through engaging, through practicing with that particular parami that month, and investigating how it appears for us in our own lives and our own practice. If any of you are coming maybe from a Mahayana background, we call these the paramitas. There's 6 of them rather than 10. So that, there's a little bit of a difference there. But for the purposes of this course, we take these 10 paramis, these 10 principles, really as the point of focus for the practice and the study. So these are some examples of the kinds of learning outcomes that you could expect from the program, from the chaplaincy training. And I've just listed a few here kind of by means of an example. A lot of these things that we've touched on already today that Jennifer and Jim and Ram have spoken about. Articulating our own understanding and approach to Buddhist spiritual care, or spiritual care in general. Like, can we sort of come to an understanding even for ourselves what that means? What does it mean to give spiritual care, to offer spiritual care to somebody? What does it mean to this idea of the ministry of presence, to be present to somebody, to be establishing and deepening, and as Jennifer mentioned also earlier, ending spiritual care relationships, discerning and working with the sensitivity and the skills around that. How do we start a spiritual care relationship with somebody? How can we begin to initiate this channel of conversation? It's not always the easiest thing if you just walk into, say, somebody's hospital room and they're sitting watching the baseball. How do we get from there to, what are the most important things in your life right now? They're kind of neat. There's a process there. There's a bridge. There's a way of connecting. So, how do we do that? Providing spiritual care to people experiencing grief and loss, which we've touched on already. Understanding the role of our own spiritual, religious or non-religious history in being able to offer spiritual care. So what are we coming in with? Like, what from our own history, from our own experience, from our own religious or non-religious upbringing is still in the room with us today and might be affecting the way that we interact with others? We had a marvelous speaker come yesterday to the Buddhist Chaplaincy speaker series, which is another element of this training, which I'll mention in a little moment. And she was speaking to her chaplaincy experience and touching on this subject of the ways in which, experiences that we've had in the past can really affect the way that we offer spiritual care in the present. And she gave the example of having had, a marriage that had ended in divorce and having had a bad experience with marriage. And as a result, in a certain chaplaincy encounter, realizing that she was very much neglecting the husband in the situation. And this was sort of only, pointed out to her, or came to her through the work and the reflection that she consequently did around what she was doing. So things like this, what is it in our past, in our conditioning, in our experience, that what is it that we're bringing in? So really like leaning into the awareness of this. Understanding effective uses of understanding effective uses of self in offering spiritual care. So practices of presence, of non-judgmental awareness, emotional availability, our cultural humility, appropriate self-disclosure. This is a wonderful chaplaincy skill. When is a good moment to say something about ourselves, and when is a good moment to hold back on that? Positive use of power and authority, self-care, sensing appropriate boundaries in a chaplaincy relationship. And then again, uses of ritual, prayer, guided meditation. So these are just some of the learning outcomes of the programs. So like Jennifer shared this earlier, this is the course structure. So there's a way in which you do a lot of work, whether you're on the in-person program or the online program. This kind of structure is the same. So there's work that we do in a group and among ourselves as a group, so working together with the group. And then there's work that we do on our own. So the work on the own, reading and writing assignments. So between the monthly workshops, we'll give like plenty of there's one assigned book every month to read like some sections of, there's some handouts to read. There's at least one, if not two, writing assignments per month as well. And then the service work that the students engage with, however that manifests, whether it's volunteering somewhere, whether it's work that they're doing within their community, caregiving within their family, lots of different options there. But the service work, generally, the idea with the service work is that it's really something that you can do where you can apply what you're learning on the program. That's the important thing. Sometimes I'll get lots of questions about, well, is this kind of service work appropriate? Is that appropriate? And the question I usually always come back with is, well, do you feel that in this context, you'll be able to apply what you're learning? And then that would make it appropriate. So it's really for you to make the most of this year and this training, to be able to be in a situation where it feels juicy, where you feel like, yes, I'm really able to sort of put a bit of grist to the mill here. And then what we do together, there's the monthly workshops. If you're in person, it is 1 day per month, and that's a Friday. It's always a Friday. And my apologies, the exact dates are not up to date on the website for the in-person and online trainings, but they will be in a matter of days. So please keep your eye on the website. My apologies that we didn't have that ready for you today. But as you can imagine, there's so many moving parts between the faculty and all of their activities that it takes us a little while to just make sure that we can commit to the dates that we put on the website. But for the in-person program, you can count on 1 Friday per month that takes place at Insight Meditation Center in Redwood City. And then for the online program, what we do is we meet 2 mornings a month. So instead of having 1 long day on Zoom, which we collectively feel would be exhausting and counterproductive, instead we have 2 half days. And traditionally and usually, with maybe very few exceptions, those are Fridays as well. So that would be 2 Friday mornings if you're in California. So the day would start at 8 a.m. and run to, with including the break, 11:30 a.m. Pacific time. And that translates to 11 a.m. to 2:30 p.m. East Coast time. And then for folks in Europe, like myself, the session starts at 5 p.m. For folks in the UK and Ireland, it starts at 4 p.m. So we've kind of managed to cover at least like half of the globe for people who want to join in the online program. We did have a participant from New Zealand last year who like an absolute champion was getting up at 3 a.m. to start to join us for the online training. And it's possible, you know, it's really possible. We tried to make this in a way that really anyone from anywhere in the world can participate in the online training. Okay. So then part of, you know, whether you're on the online or the in-person, the other elements of our group work together is every 2 months, there's a mentor interview. So a one-on-one, 1 hour session with one of the faculty, and that rotates. Each person on the course is part of a small group of about 4 or 5 people, and that small group meets once per month. And with the you also get paired up with a buddy, like a kind of a study partner for the year. And you're expected to meet with your buddy once a month as well to check in with one another. And then on top of all of that, you can see these little green boxes that we've got the speaker series. So this is also a wonderful component of the program. One Saturday per month, there's a 90-minute long session where we invite Buddhist chaplains, mostly Buddhist chaplains and non-Buddhist chaplains, but people who are working in the field or in, you know, adjacent activities, who come in and talk about their work, who talk about their experience, you know, who talk about the issues and subjects that are very alive to them and share that. And for the most part, the students of our program then have a little time after the talk with this person to be able to field, you know, specific questions. And I always encourage, you know, if there's anything in your service work, in your study that's coming up, you know, please do, you know, bring it out and you know, communicate that to our guests, because there's so much knowledge and experience to be shared there. It's really wonderful. It's one of my favorite parts of this whole program. And I'll mention also that Jim, who you just heard from, is the co-organizer of the speaker series as well. So Jim's really put a lot of work into bringing very interesting people in to speak to us. And then field trips. So field trips for the in-person training, there are actually organized field trips. I believe that there's one happening this year going to one of the prisons in the Bay Area. Field trips for the online program have to be more like self-motivated. Unfortunately, since we're spread around the world, we can't all go somewhere together. But we encourage people and everybody, in person and online students, to, you know, educate yourself with what's going on around you. You know, perhaps at Christmas time, visit a church, or if you have, you know, Jewish friends that could take you to a synagogue or a mosque in your neighborhood, any festivals or celebrations, you know, anything that could be informative. Some people perhaps go and sit in on like a 12-step meeting if they haven't already been to one in their lives, or, you know, lots of different kind of opportunities to engage with the different communities of caregiving. So we really encourage the field trips where possible. So time-wise, you know, what do you need to anticipate in terms of how much time you would need to put into the chaplaincy program? So like I mentioned, this kind of gives you like a rough, you know, a rough idea. There's the 1-day workshop per month, total 1 day, whether it's 2 half days or a full 1 day. For people doing the in-person program, there is a retreat halfway through the year at IRC in Santa Cruz, and that's a 2-day retreat. There is 10 hours expected, like what we recommend is about 10 hours of service work per month, which, you know, works out to like a couple of hours a week, 2 or 3 hours a week. The speaker series, which is 90 minutes per month. Then the 1 hour mentor meeting every 2 months, 1 hour buddy meeting, 1 hour small group meeting. And then it's hard for me to say how much time a written assignment or reading takes. Obviously, that varies from person to person. So you know for yourself, you know, if you're a slow reader or a fast reader, or, you know, how long you spend with written assignments. But we do encourage that you put a lot of time into this. A lot of the written assignments are a very reflective nature and really benefit from time being spent, in a sort of horizontal fashion too, that you might start it and then come back to it after a few days or, after a couple of weeks, and kind of rework things in order to really get the most out of the reflective process. So when people ask, I will tentatively say, if you have 5 days a month that you can give to this, I think that, that's a good start. Like that's a kind of a good ballpark figure to be thinking of in terms of, do I have enough time? Do I have the capacity, time-wise, to be thinking about this right now? Okay, and then just some other details about the course, FAQs. Like I mentioned, there's an online and in-person options. It lasts 1 year. We begin, just shy of a year. We begin in September and end in July. The cost is between $2,000 and $4,000 on a self-determined sliding scale. So we leave that up to you, where you feel that you land on that scale and how much you can give. There are work scholarships available. We understand that amount can really be a lot for many people. So if you would like to apply for a work scholarship, then you can reach out to us directly, and then that's a side process. The group size for both cohorts is usually between 12 and 24 people. It really varies from year to year how many people apply, or how many people, not necessarily everybody who applies eventually starts the course. Through the application process, there's also an interview, and during that interview we have a conversation about, is this the right moment for you to be doing this, or is this really the right program for you to be on, or perhaps you need to be somewhere else, perhaps this isn't the right thing. So that's part of the application process. So it's not necessary that we always fill out to the full 24. So the number of the cohort could be anywhere between those two numbers. Applications open soon. They start on May 1st. That is the first day that we will start reading applications. I will send you the link for our website where the enrollment page is. And there's a separate application form for the inline and on-person programs. So you're welcome to start working on those as soon as you like. We're pretty much there. And the applications end when the group is full. So on that enrollment page on the website, we do keep updating it to let you know, if there's still plenty more places, feel free to apply. But I would say that if you really do feel certain at this stage that you want to be doing this training starting in September, I would apply sooner rather than later. Okay. And then just the application costs $100, and the requirements for application are that all applicants need to have a regular and committed Buddhist practice for at least 4 years, and that you've been on at least 3 Buddhist retreats of about 1 week each, or some kind of equivalent to that. Okay. And it's very normal that I get a lot of questions around those 2 points too, of like, well, I've done this, or I did that. And that's fine. Come to me with those questions. That's fine. We can figure that out. And then the faculty. So like I mentioned, for the in-person program, there's Jennifer, Gil, and Paul. And you may know them, perhaps I think there's a few people here who are already Gil or Paul students in their Dharma practice. And then on the online program, there's myself, Trent Thornley, who I mentioned, he's a chaplaincy educator. He's a CPE educator and the director of the San Francisco Night Ministry. And Dawn Neal, who is a Dharma teacher, and she is the residential teacher for Insight Meditation in Santa Cruz. And she also works as a chaplain, has worked as a chaplain. Dawn and I worked at Stanford Hospital together a few years back. So, that was a lot of talking. That was a big old information dump. I hope that some of that soaked in. I will be sharing all of that information. Either I'll share the slides or I'll share the notes that made the slides in the email that you'll get following the session. Okay, so if you didn't get all of it down, don't worry. And there's a lot of information on our website. I wonder if, Jim, would you be able to put, or have you maybe already put the link in for just the chaplaincy section of our website and maybe the enrollment page as well?
Sure, yeah, I can do that. And then there was one question I couldn't answer from Eileen. It says, can we choose which time would work for us in our time zone for the half days? I think for the online program.
I see. That's a great question, Eileen. We've got fixed times for that. We've got fixed times just because of the way that the time zones go, and the faculty availability. So like I said, depending on which time zone you are, we go from, it's 3.5 hours from 8 a.m. to 11:30 a.m. Pacific, and then according to where you are.
Okay, just to clarify, I meant, can we choose the afternoon instead of the morning? You know what I mean? Like, you have one that starts at 5 p.m. Can we choose that one?
Oh, no, it's the same one. It's just that that's the time in Europe when it starts.
Right. But the time in Honolulu, the 8 a.m. does not sound very inviting to me. So
no, that would be 5 a.m. for Honolulu. Exactly. Yeah.
So could I choose 5 p.m. class is what I was trying to find out.
Right. No, there is just that one session. That's just that one session that would start at 5 a.m. Honolulu time, unfortunately.
Okay, I understand now.
Yeah. So let me see where we are time-wise. Okay, wonderful. I've told you everything that I meant to tell you, and we've got about 20 minutes left now. So now is the time where you can come forward with any questions, comments, anything that's on your mind, or anything else you'd like to know. So please do, and please do turn on your sound and say the questions too, because I just love to hear some voices. Yeah.
Vanessa, there's a question from Aaron on, I know the Eco Chaplaincy program has its own orientation. Yeah. Yes, that's a different orientation. We are going through the 4th iteration of the program now that ends in December this year, right? And the next program likely will start sometime in the middle of 2026, probably. This year we started in August of 2024, that ends in December. It's about 18-month program. And that program is all online. Plus, it has 2 one-week retreats, in-person retreats, right? So all the in-person retreats, we hold them in a nature setting, particularly camping, and essentially be able to connect with nature in so many ways. And the first one was back in October. We did in Sierras, and the second one is this July. We're going to do it in Aptos near Santa Cruz, right? So that cohort typically, we've been having about 30 people in the cohort. We started it, this particular cohort has 30 people. Last year also, we had about 30 people in that cohort. And the application process for that would begin sometime February, March timeframe next year. Yeah.
Thank you, Ram.
Okay.
Hi, Kashmira.
Yes. Yeah, first of all, thank you so much for this information. This has been very, very useful. My question is, let's say if I sign up for one of the courses, is there a way to accommodate a travel or sometimes a skip session because you are not in town, or you're unable to do it because of your travel or some other family, needs?
Yeah, no, that's completely understandable, and it happens. I think it's so unlikely that somebody can commit, to the 11 specific dates or during the course of the year. We say that if you skip one date, if there's an emergency or something and you need to skip a class, that's fine. All the classes are recorded, and so it's possible to catch up with the recordings afterwards. If you need to skip more than one class, then we normally have a conversation about other ways to then start to make up for that, maybe an extra essay or two or some kind of assignment that would make up for like more than one skipped class.
Yeah. So my concern is that usually when I have to travel to India, and usually that's more that it's like a few weeks because we stay with family, and I possibly could do the assignments but maybe not be there in person. So you think that can be folded into the.
Yeah, it's such a good question. And I think it comes back a lot to sort of just discerning, like, is it the right moment for me to be doing this program? If there's, for example, I would encourage or hope for everybody going into this program that you have a kind of year where there is some spaciousness, where perhaps there's not a lot of busyness on the horizon, or where there's not going to be too much travel, where you really feel that you can sort of commit yourself to the rhythm and the learning. And, for some people, sometimes we've said, if this year just looks really busy for you, maybe next year's your year. Maybe this just, it's not going to work if there's too much, if there's foreseeably on the horizon, more than one class that's going to need to be skipped, then unless the other option obviously is to do the online program, which can be done from anywhere in the world.
Yeah.
But I guess I would say that, which is a little bit maybe non-specific in terms of how you're trying to think about it. But my encouragement would be that you do have the space and the ability to focus and to attend like the vast majority of the sessions.
All right. Okay. Thank you.
Okay, thank you. Yes, Marianne, hi.
Hello, Vanessa. Hi. So are the readings, or is the course sort of like being in a graduate program, or what's it like in that sense?
You mean what kind
or it does, not that it needs to be, but just wondering. Yeah.
Yeah, sure. Well, we say it's a graduate level training, in that I think that, the being able to read, we say that there's about 100 pages worth of material every month to be read, whether it's through the handouts or the books that we recommend. Somewhere on the course website there is an example of some of the books that we use. And so you could take a look at those and discern for yourself. But there's a couple of books that we have on our reading list that are used on CPE programs. That I would say that they're a little more advanced, in some ways. And then there are some books that are more universal or might be picked up by anybody, who not necessarily training in chaplaincy. Sometimes we share even on the odd occasion, like a research paper or something, if somebody has the leaning towards reading in that way. So yeah, I would say that for sure it's I've heard feedback that the reading definitely kind of it encourages a lot of engagement, like you sort of it does it helps with the focus and it can it can be a bit of a challenge. So yeah, I hope that helps. Thanks, Marianne. And if any point Jim or Jennifer or Ram want to add, because you are all familiar with all of these readings and
Yeah,
content.
thank you, Vanessa. I think as a student, I tell you, it is a graduate level program, but there is almost, I felt like what you put in is what you get. This is a beautiful contemplative program. Right. It's not about finishing of the assignment that is utmost important. It is about the learning and the growth process. And that's what I found out so rewarding to put time in. And to Vanessa's point, I finished 2 units of CPE. This program aligns pretty much with the first unit of CPE quite well.
Thank you, Ram.
Vanessa, it's Morgane again.
Morgane.
Thank you for all this. I'm just curious, do you intend to have this next year if someone for some reason weren't able to sign up for this year? Do you think it may happen again?
Oh, yes.
Okay.
I mean, natural disasters notwithstanding, but like I said, the in-person program's been running since 2001. So there's and the online will be entering its 3rd year. But we have every intention to continue these courses into the future.
Lovely. Thank you very much.
Absolutely.
I have a question that could be for anyone. It's maybe a little bit of a lame question, but it's in the spirit of Jim's comment about what we have in spades. Would somebody speak to what you think this program has in spades compared to something like Upaya's program or some of the other chaplaincy programs? What's done really well here, particularly differently?
Great question. Thank you, Dave. I'll see if any of my friends want to answer these. Jennifer.
Okay, so there are different locations for the programs. There's different costs associated. There's different levels of academic work. So I know at Upaya, people write like a final paper. Yeah. That is linked to whether they complete the program or not. So I don't think with reading 100 pages a month, which is pretty a low number, we're not really strong academically. And so, for example, if there's a book that we assigned 100 pages, we don't, at the next workshop, ask people questions to make sure they've read it, you know. So, because, you know, it's as I showed of that chart, you know, there's stuff we do together and stuff you do on your own. And as you said, Ram, what you put into it, you get. And so I would imagine for any chaplaincy training program, that's true. Or let any training program is like, you know, for example, I recall that Ram, you cannonballed into the deep end of this training pretty early on. You know, you just get a running start, and then before we knew it, you were like off the deck and over the water and just on your way down with a big splash. You know.
Well,
And
part of the
subtle.
reason, Jennifer, I was finishing up my eco chaplaincy program, so I had almost just finishing that when I started this. So I had a bit of momentum coming from.
That makes sense. That makes sense. I did not recall that. And then, Jim, I think you've been like the slow and steady engagement, you know, not a cannonball, but just like a water on a stone, you know, just eventually enough drips and it wears a little indent in the stone. So
Well, that's a lovely image. I'm not sure how to take that, but it's a lovely image.
in a positive way, you know, that I think being steadfast on something, it's just regular attention, you know, yeah, and that you're not rushing through the process too. You know, you're not turning on a fire hose to wear out that rock. It's just a drip, drip, drip. And then Vanessa sprung out in this program like the Venus de Milo in that great painting. It's somewhere in Italy. Yeah. Botticelli's Venus de Milo just pops out of this clamshell, you know, and has many mystical talents. Okay, those all have water involved. That was not intentional. This is just what came to me.
Mm.
I have something to say to that as well, Dave. I mean, a lot of Upaya and the contemplative care in New York, I think they're more Zen focused, right? And I mean, my background, I'm a Zen person, but one thing I didn't anticipate that I really enjoyed about the Sati program is that we have different perspectives. So we have Paul Haller, who's a Zen teacher. Jennifer, she has a different background within Buddhism and within other religions. And then Gil is a Vipassana teacher, also with a Zen background. And one of the unexpected consequences for me is that I'm now training in the Vipassana tradition. And I wouldn't have anticipated that, but I just loved so much the way that Gil talked about the Dharma. And so now, you know, I've done retreats with him and kind of practicing somewhat in that tradition, still in Zen too. But the fact that there was this broader view of the Dharma, and it wasn't just like this is what Zen or Mahayana says. And I don't know too much about the other programs, but that was something that I didn't anticipate, but I really loved about the way that the Sati program's set up.
So I imagine there's no friction whatsoever as far as traditions, differing traditions.
It rarely comes to blows.
Yeah. Oh, so there's some.
I'll say also that on the online program now, I myself come from a Zen background. Dawn is a Vipassana teacher, and Trent is in the Tibetan tradition. So all three, and he's a Christian minister as well. So we've tried to continue that, and I'd like to add just one more thing. I think for me, as someone who went through the program as a student, we have this expression in Zen about transmission where we say warm hand to warm hand, and that really was my experience of going through this program as a student, and it's something that I aspire to continue in now leading the online program. But I think there's a way in which Jennifer, Gil, and Paul hold the program with so much humanity and so much warmth that just allowed so much space for learning and becoming. And yeah, I would say, I can't speak for the other programs. I'm sure they're wonderful. And they have all different, there's different reasons for taking the different programs. And I encourage you all to look into them, and part of what we send you will have links to Upaya, to the Center for Contemplative Care, because really you should check out all your options. But anyway, that's what I would say that's really stuck with me about this program.
So lovely answers. Thank you, all of you.
Thanks, Dave. Hi, Jet. Did you unmute? You had a question, I think.
Well, I was just going to say that when Gil first pointed to this program, announced it within his community, he was pointing to the paramis as a structural focus, as a really beautiful way for all the different folks to kind of let go of all that language grounding and all that book learning, and work in a little different way, maybe a little more formless path, Thich Nhat Hanh might have said, in this way. And that struck me as really beautiful.
Lovely.
Another way to continue to grow.
Yeah, lovely. Thank you, Jet.
I'd like to add one last thing, new topic. There is a national chaplaincy organization. I'll put the link in the box. It's called the Association of Professional Chaplains. And they have resources, they have membership, they give out the what's called certification, the kind of the gold standard credential. And so it's just in terms of your own discernment and orienting towards the territory, I think that would be helpful. So let me put that in the chat right now.
Great, thank you. And I'm also going to put in the chat my email, the email that you can reach me or us on, which is bct@sati.org. So that's the Buddhist Chaplaincy Training, bct@sati.org. So no question too big, no question too small. Please feel free to reach out. If you are interested in the programs, or eco chaplaincy, or Anakampa, any of the sort of programs that we have at Sati, particularly the chaplaincy training. I hope this has been helpful. Our intention was to communicate something about chaplaincy, Buddhist chaplaincy, and the programs. And I'm so grateful that Ram and Jim have joined us today as well, because I feel like you're, just the way that you tell it, it comes alive. You really just see where it's taken both of you, and I find it really touching. I feel privileged to have seen you both kind of go through that journey, and where you are today. So thanks so much. And thank you, Jennifer. Thank you for doing this since 2001.
I'm just getting started. Don't worry.
And thank you all. Thank you all for coming. Thank you for staying with it, for your questions, which have been brilliant. And we've tried to answer most of them if we've been able to. And just wishing you all a happy conclusion of your weekend. And I will just pass it to Jennifer, Jim, and Ram, if there's anything else you'd like to say before we say goodbye today.
I'd like to dedicate the merit of our time together. But before I do that, how about Ram and Jim, if they have any closing words?
No, just gratitude, much gratitude for the opportunity to be with you all. It's beautiful. No, anything that can be of service, please let me know. Thank you.
Yeah, and I'll just say, this chaplaincy through the Sati program has been a real life changer for me. And hopefully this might be a pivotal point for some of you, because it's been a real blessing in my life. So thank you to Jennifer and Vanessa.
Let us take a moment to reflect on all the beings who have created this moment and this workshop. People at the Sati Center for Buddhist Studies, the National Professional Chaplain Organization, the people who brought the Dharma to the West, the people who maintain Zoom so we can be together, the plants and the trees and the magical creatures. And lastly, let us dedicate the merit to all the people who support all of us: family, friends, neighbors, teachers, Sangha members, family. There are so many unseen ways that we are supported. So let's dedicate the merit of our time together to all these beings. May they be free from suffering and the causes of suffering. May they be happy. And may they realize their Buddha nature. Ding! Thanks, everybody.
Thank you.
Thanks so much, everyone. To say, unmute yourselves to say
Thank
goodbye.
you.
It's nice to hear your
Thank
voice.
you.
Thank
Thank you.
Thank you very much.
Thank you.
Have a good
Goodbye, all.
evening, everyone.
Bye.
Thank you.